I had another time, and this is a very personal thing. I was pregnant. I was in the OR and I was taking care of a young fella, and I was basically replanting a finger, and I was 3 months pregnant. And so all of a sudden, while I'm operating, I feel this really kind of squishy feeling. And now I like there's fluid, in my pants. And so trying to figure out like, oh, what what's happening. So I paused the surgery and I just tell everyone I need to run to the restroom really quick. And I go and I'm clearly bleeding. And so I call my OB and she says, "Hey, we need you to come here right now." And I said, "Well, I can't. I'm actually in the OR right now. I'm in the middle of a surgery. I'm replanting this kid's finger." And so she said, "Okay, well, you call me as soon as you're done, and as soon as you're done, get over here." And so what's happening now is that, now she and I both know what's happening and I'm miscarrying. And so I've got to get back to this place and like, rolling up wads of toilet paper, stuffing it in my scrubs so that I can get to this and not be bleeding all over in the OR and get to that, hurry up, finish up that surgery, knowing that I'm losing a child. And I've got to separate from that moment. Meanwhile, this is like devastating. And I can't even get to the medical care that I need because my alliance is to the patient and my responsibility is to the patient, but my real responsibility is to me. And we don't have any backup ways to say, hey, is there someone who we can call who can maybe drop what they're doing and come over and help and get this? That's never the thought process. It's always about, I just need to gut through this and I just need to get through this and then I'll take care of me afterwards because the person in front of me is the most important person. I think we have to get away from that. And I ended up, I left and I went on to miscarry and I ended up having to have a procedure the next day. And so I was even stressed about that because I was having to cancel clinic. And where are those patients going to go? We have to get out of that mindset and we really, really have to start paying attention to our health. Health is wealth. And so we have to think about longevity. We have to think about our sleep. If we're not sleeping, we are not cleaning our brain at night. And that is going to lead to dementia. It's going to lead to all kinds of issues. And the problem is that if we're saving ourselves for some other world and life and quality of time with our family, once we finish this role as a healthcare provider, we're never going to get to that. We're going to die out or we're going to disable out in some way and we're just not going to be available for them. And or gypping us, right? Because we deserve better. And I think this is some self-worth talk that we have to have with ourselves that we matter. We matter the most. And everything it is needs to be focused on our own health and everything else can go after that because if we're not here, we don't need to worry about someone running the clinic or doing the surgery if you're dead, right? Or if you're disabled in some way. It's just that's not our future that we want to have. I want to make sure that we're eating well. We've got to eat every day, and a lot of us are soothing ourselves with food and alcohol. We have to stay away from artificial colors, artificial flavors, high fructose corn syrup. These